Hello and welcome back to our channel. I hope you have been enjoying watching all our videos. Please consider subscribing if you would like to watch more of the informative content we are going to create. Today's video is going to focus on Inspire Global Assessments, which was formerly known as Ncas. And I made a video around 6 years ago, and you guys really have found that informative. So this is an updated version of the same video. Now, Inspire Global Assessments is just like Ncas, based on the similar format, but now it has a wide range of candidates or internationally educated nurses to cater to, because now we're not only limited to BC, but many other provinces. And I'm going to link down all the information in the description box for you guys. Now, coming back to IGA or Inspire Global, this assessment is going to be two-part assessment where they will be assessing you on CBA, which is your computer-based assessment. You will go to a Prometric center and sit down and solve some questions based on the case scenarios, and we're going to unfold those things in a bit. The second part of this test is Simulation Lab Assessment or SLA. And for this test, you either can test yourself in BC, in Langara College or BCIT, or you can test yourself in Dalhousie, which is in Nova Scotia. Okay, talking about the new updated version of CBA exam, what are the new changes and what are the new formats of questions? Now, earlier on the exam, you would just see either multiple choice questions or select all that apply or multiple select questions. But now we have different formats of this exam. So who are the candidates of this exam? That is the first and foremost piece of information you would like to know. So anybody who has done nursing in their home country and they would like to transition their license here, in majority of the Canadian provinces, they want to test your competency level, which means that they not only want to test your knowledge based on nursing, but they also would like to see how efficient you are to work, how are your hands-on skills, and also your knowledge of the Canadian healthcare system. So when you go for this exam, you will be tested for 3 professions, 4 basically. The first one is for HCA or healthcare assistant, which is going to be the most basic form of assessment. Then we have LPNs, licensed practical nurses, where you go through an intermediate type of assessment. Finally, we have assessment for registered nurses or RNs, and this one is called an advanced form of assessment. The fourth profession, which is not very popular among internationally educated nurses, is registered psych nurses, which are, I believe, only there in 2 provinces, BC and Saskatchewan. Now, other than that, apart from internationally educated nurses, sometimes we have nurses who have done their education in Canada, but they have been out of practice. They were LPNs, care aides, or RNs, and they've been out of practice for over 5 years. Even they have to undergo the same assessment, which is the same as IGA, CBA, and SLA. Now, when it comes to CBA, it is computer-based assessment. It is a written exam. And how it flows is you get a case scenario and you get a bunch of case scenarios, and they're like unfolding case studies. One after another, you see questions. There can be around 10 to 14 questions in every case scenario. And the catch here is that it is progressive, which means that once you solve a question, you submit it, you go to the next question, you pretty much can understand whether you attempted it right or not. But unfortunately, you cannot go back and make corrections on the exam. It's just like, how you give medication to your patient and you found out that it was a med error, but now you cannot go back and take that medication out of their body. So that's how the CBA model is for testing you. So be careful when you're reading those case scenarios. Now let's break it down on the number of questions, because I'm sure you guys should be eager to know that. For RNs, which is the advanced assessment, we have somewhere between 161 to 172 questions, and you spend 5 hours on this test. So because it's a long stretch of time, you get a break in between, which is approximately 15 minutes scheduled break, which is not counted towards the hours of your test. But I personally recommend taking breaks whenever it's necessary, because it's a mind-boggling situation. Lots and lots of information is thrown at you. So take breaks and go slow. Then when it comes to LPNs, which is the intermediate testing, you get somewhere around 111 to 119 questions. This test runs for 3 hours. When it comes to HCA, which is the basic testing, 65 to 69 questions. And again, you sit there for 3 hours. And there are no scheduled breaks for LPNs and care aides. Moving on to the types of questions. Now, this one's, which is the interesting part. You no longer have to just stick yourself to multiple choice or multiple select questions, but there are more options. For example, I'm going to read them out from my notes. We have matching exercises. We have hotspot identification, sequencing tasks where you have to put everything down in sequence. If you've done your NCLEX, you recognize those questions as drag and drop questions. Then there are written open responses where they want you to write down some like 3 points of patient care or write a little bit of a report situation. And they also give you word limit, not more than 20 words, not more than 60 words. It will be clearly mentioned on your question. And finally, there are audio-based responses where you have to speak and you get 3 chances. You can do like 3 attempts of speaking and your audio is supposed to be within 60 seconds or within a minute of time frame. So these are the newer format of questions. And for this format, they have printed or published candidate guidelines, which are available on their website. So you can go and check them out. Also, when you create your Inspire account, you get to practice these types of questions there. There is one small practice test. So you can actually see how it feels like when you record your audio or when you type your answers. Like you don't get any results, but it's a good way to practice and get used to the format. Then moving ahead, now let's talk about the simulation lab. So simulation lab is an in-person, you work in the lab environment, you work in similar environment as to Canadian healthcare settings. You might see emergency rooms, medical floors, surgical floors, or even sometimes there are like long-term care patients, or it could be even situated in somebody's house. Like there's a situation like a person's home and you pretend to go as a home support worker or home health nurse. For RNs, this exam is very intense. RNs go through 5 stations. Each of these stations run for 25 minutes. You have 5 minutes to read the entire case script, what you're going to expect. 15 minutes you run through that simulation. And last 5 minutes, you spend wrapping up or giving report if that's something which is required in that station. And your assessor will give you time frame warnings after 5 minutes, after 15 minutes, and when you finish the station. Now, out of these 5 stations, 2 stations are going to be based on standardized patients who are very good actors. They know what they're doing, and you will never feel like that, oh, this looks like a young woman, but on the case it says 82-year-old. She's really going to behave like an 82-year-old woman. So there are standardized patients, actors. Then we have 3 stations with high fidelity mannequins. And these mannequins are going to breathe. They're going to blink their eyes. You may find them creepy, but they're very fun to work with. For LPNs, SLA has 3 stations in total. So there will be 1 standardized actor for our standardized patient for LPNs and 2 high fidelity mannequins. And finally, for the care aides, there is only 1 station, which runs for about 60 minutes, and it's on a medium fidelity mannequin, and they give you different tasks to complete because as an HCA, which is not a very autonomous profession, you have to follow the care planning. Whereas when you go for your RN and LPN SLA, you're more autonomous, you're more under your own decision-making. Clinical decision-making is part of that. So you do assessments, you make decisions, you plan the care for that patient. So when it comes to care aid, it's just tasks and you follow them along, right? So these are the differences between CBA and SLA when it comes to IGA. Now, another thing which is very fun to know when you go for your SLA is that even if you're working with high fidelity or medium fidelity mannequins, they are able to respond back because there is a dark glass and there are people sitting on the other side and they're watching you and they're doing all the conversation with you as it is ongoing in the scenario. So you will never feel that something is missing or this is a mannequin. How do I care for them? And there will be 1 assessor in each of the rooms. You change rooms. The assessors and the patients, they stay in the same room and they're constantly assessing you. They are not allowed to show you their emotions. They just make their assessments on their iPad or on their checklist. Don't bother watching them. Don't bother thinking that, oh, whether I'm doing right or wrong. Just give your best for this exam. Now comes another fun part, which is the results. Now, what am I expecting? What am I getting out of it when I go for this assessment? Now, when you get your results, they are accumulated results from your CBA and your SLA. And when Ncas gives you result, they look something like a vague bar graph, which we're going to put on the screen. And all you understand is whether you are in undemonstrated area or you're in emergent or you are consistent. Now, as under testing situations or even as an internationally educated nurse, I would say do not expect too much from yourself, thinking that, oh, I want to be consistent in everything, because you will not be. Even if you stay somewhere between emergent and consistent, you should be happy about that. You really did a good job on your exam. Now, once you get that vague graph result based on your 10 to 12 competencies under which you were being tested, then BCCNM will take over. And once BCCNM reviews your resume, your reports from your education, your Ncas and everything, then they will make a comprehensive result, which will tell you if you're going for a few courses, you're going for a re-entry program, or you were not good enough that they want you to repeat your nursing program again, which is very rare and has never happened in any of our students' case scenarios. That's how the results are made. So basically, what you must understand here is that results are never pass or fail. Nobody passes IGA, nobody fails IGA. It's always the gap identification, which is a good thing in my opinion, because those gaps will help me identify where I lack now so that I can prepare myself for becoming a better nurse or better care aide when I actually practice in future. And education can be done, if you're specifically in BC, I can tell you education can be done through Kwantlen Polytechnic, which is the most popular spot for a majority of the students. Then Thompson River University also has a very good program for IENs. Then Lingara College also provides some sort of education. And then you can also go out of province. There are some universities which accept out of province students, and you can go and get your re-entry program or get your courses done through those universities as well. Once you are done with the courses, education, then BCCNM gives you the eligibility to write your final exam, which is NCLEX RN in case of RNs or REX PN in case of LPNs. For care aides, once you finish your education, you get your license and you're good to practice. Right? So this is all what I wanted to give you as an overview, a detailed overview of this assessment, the new format. And we run classes throughout the year for both CBA and SLA. If you would need help or assistance in any of these areas, feel free to give us a call at 604-613-2633. And we would love to be part of this wonderful journey for you. Also consider subscribing because there are more videos lined up on similar topics. And that's all from my side. All the very best for this journey, and thank you.